So what we're trying to do is update these recommendations that we've put out on a regular basis. These that I'm presenting today are really just the changes from last week. They don't represent, I'm not going to repeat what we said last week. We actually met earlier today, and so these are sort of hot off the press, and they're not yet on the website, but they will be very shortly, by tonight or tomorrow morning, hopefully. And you can get them by going to the crohnsandcolitis.ca website, and this is a QR link to directly get there. The travel advisory has not changed from our perspective. Again, we recommend that patients with IBD who are immunosuppressed not travel, but obviously what's changed is that the Government of Canada is recommending everybody not travel at this point in time outside of Canadian borders. Again, but I'm putting this up again because the QR link here is directly to the Public Health Agency of Canada's website, where you can get all the travel advisories to know what countries particularly are recommended not to travel to. So I'd like to start a little bit with some definitions first, because we used terms last week that perhaps people didn't fully understand, and I think it's worth defining what we're talking about from here on in. So as Gil mentioned, physical distancing, which was previously called social distancing, we're now calling it physical distancing because that's what it is defined by the Public Health Agency of Canada as avoiding crowded places, non-essential gatherings, avoiding common greetings like handshakes or hugs, limiting contact with people who are at higher risk, and many of you will be the people at higher risk who are immunosuppressed. So people should be limiting contact with you, unfortunately, except for close family members, as we'll mention in a second, and keeping at least 2 arms length apart. So that's 2 meters or more apart. Hygiene is defined in this case as washing your hands often with soap and water for a minimum of 20 seconds, or with hand sanitizer, alcohol-based hand sanitizer with 60% concentration of alcohol or higher. In addition, you should be coughing or sneezing into a tissue and disposing of it immediately, or coughing and sneezing into the bend of your arm and not your hands. As well, avoiding touching your eyes, nose, and mouth with unwashed hands. Self-monitoring means paying attention to yourself for 14 days and avoiding crowded places and increasing personal space from others. This is essentially something that we should all be doing already, and hopefully you are. Self-isolating means that if you have no symptoms, but if you have traveled or had contact with somebody with COVID, stay at home and monitor yourself for symptoms for 14 days, avoid contact with others, but you can still go outside for walks, runs, walking the dog, as long as you stay 2 meters or more from everybody else. So remember this word self-isolate, because we're going to use it in reference to people with IBD in a few minutes. And then isolating means that you either have symptoms of COVID, or you were diagnosed with COVID, or you're waiting for a test to confirm whether or not you have COVID. In that case, the Public Health Agency of Canada recommends that you stay home and avoid all contacts with others, even with family members if possible.